today we are going to discuss on a most important topic, so that is the difference between, so that is Addison's disease and the Cushing syndrome. Now coming to the differences, we are going to see in so many differences, so between the persons who are suffering from Cushing syndrome and Addison's disease. Here the person who are suffering from, so the Cushing syndrome, so they can show the different characteristics, and the person who are suffering from, so that is Addison's disease, they also exhibit, so that is very different characteristics. So let us see, so what is the difference is there, so the comparing to the Cushing syndrome and Addison's disease. The first note is why it is called as a Cushing syndrome. Because, so the American neurosurgeon, so the Dr. William Harvey Cushings, the first time in the 1932 it is discovered. For that reason, the name given as a Cushing syndrome. Now coming to the Addison disease, why it is called as an Addison's disease? Because Thomas Addison is a physician. He discovered, so this disease in the year, so that is 1855. Okay, for that reason it is called as an Addison's disease. Now coming to the cortisol level in the, so that is both the Cushing syndrome and the Addison disease. In case of Cushing syndrome, so that is increased in the cortisol level. So it is hyperactivity, okay? So that is adrenal gland. The Cushing syndrome also we call as an hypercortisolism. It means, so there is excessive production of so adrenal hormones, especially the corticosteroids, the cortisol hormone. Here, so in case of, so there is Addison disease, so there is less secretion of, so there is cortisol and the aldosterone hormone. It is also we call as an adrenal insufficiency, primary adrenal insufficiency, or so there is hypocortisolism. Because there is a less production of, so that is cortisol. Now coming to the function, here the adrenal glands overactives. It produces too much. In case of, so the Addison disease, so there is the function is very less due to that hypoactivity of the adrenal glands. So there is less secretion or insufficient production of, so that is adrenal hormones, especially the cortisols and the aldosterons. Now coming to the blood sugar level, the persons who are suffering from Cushing syndrome, they shows the hyperglycemia. It means increased blood glucose level. The persons who are suffering from Addison disease, so there is a decreased, so the sugar level. Now coming to, so the symptoms, the persons who are suffering from Cushing syndrome, especially the moon face shape and the buffalo hump and the truncal obesity. Okay, so buffalo hump, the most important characteristics of buffalo hump and the truncal obesity as well as the moon face appearance. Okay, so these are the most important features of, so that is Cushing syndrome. The persons who are suffering from, so that is Addison's disease, the generalized body weakness and so hypotension and the hypoglycemia. Okay, so these are the important, so the features we are going to see in the persons who are suffering from, so that is Addison's disease. The only generalized weakness is the hypotension, hyponatremia, and okay, so these are the important features of, so that is symptoms of, so that is Addison's disease. Now come to the skin. The intermittent changes in the persons who are suffering from, so that is Cushing syndrome, very thin and fragile skin. And the stria mark, so that is skin mark is there. The persons who are suffering from, so Addison's disease, they are having a hyperpigmentation or a bronze appearance of a skin due to the ACTS accumulation in the blood cells. About this, so the BP, the blood pressure, the persons who are suffering from Cushing syndrome, they are having a hypertension. Because of sodium excess in the blood, they exhibit the hypertension. The persons who are suffering from Addison's disease are going to see hypotension, that is sodium deficiency. Now come to the, so electrolyte. Here the sodium is high, so that is we call as hypernatremia, and the potassium is low, so that is hypokalemia. The persons who are suffering from Addison's disease, they are having the less sodium, the decreased sodium level, so that is hyponatremia, and the increased so there is potassium levels, that is we call as hyperkalemia. Now come to the treatment options. So here the persons who are suffering from the Cushing syndrome, so there is options like a surgery, radiotherapy, chemotherapy, and so the symptomatic management is there. But the persons who are suffering from Addison's disease, the only one more option is, that is HRT treatment, that is hormonal replacement therapy. Okay, so this is about the difference between, so the Cushing syndrome and the Addison's disease. Thank you.